Hello viewers, you're welcome again to another episode of the Pew and the Pulpit from the Anglican Church of the Holy Spirit, 3840 Bronx, New York. Today we have in the studio our own doctor, Dr. Somechukwu Onoha. He has been a very, would I say encyclopedia, and I think he has it all. Doctor, you're welcome again.
Thank you very much.
So today, by the special grace of God, we're going to be looking into another topic. Today, we're going to look at a topic on called headache. This headache, and I know that a lot of people have been having headache for different reasons, and we don't know what is the cause of headache. Sometimes people die of headache. They say, what killed him or what killed her? They say it's headache. So I want you to, doctor, to talk to us about what do we need to know about this topic. What is actually headache?
Thank you very much, viewers. Welcome again. So headache, yeah. All right, it dates back into the ancient Greek, Roman Empire, and Egyptians. Headache, we know the head is what we used to think. So people have had headache as long as we've been human beings on earth. Headache, whether it's psychological or headache due to medical reasons. Headache, by definition, is any discomfort in the head or neck region or both. That is simply headache. Medical parlance, sometimes we say somebody has cephalgia. That is just the same thing as headache. This headache could be primary or it could be secondary. So primary means you just have discomfort in the head or in the neck due to no other particular reason. Then it could be secondary. Secondary meaning there is another condition in the head or in the neck that is present but is now giving you the discomfort of the headache. Now, the headache could come in various forms of intensity. So normally we say there's mild, there's moderate, and there's severe. Just the way we describe pain symptoms. We say mild if it's 1 to 3, moderate if it's 4 to 6, and severe if it's 7 to 10. We use the same way on a rough scale to ask someone the extent of the discomfort. So with this we can grade, and then after that we can look at the type of headache, and when we take the history, we go through so many other things. So headache is just discomfort in the head or in the neck. It could be primary or it could be secondary, that is the discomfort occurring due to another disease entity.
All right, doctor, thank you for giving us this definition about what is a headache, because I know that everybody at one time or the other sees these symptoms either for one reason or the other. So now that we have this working definition, can you tell us what are the causes? What could cause headache?
Okay, so many things could cause headache. Finally, the pathway is that there is going to be a disturbance of the transmission in the brain for you to have this discomfort. Sometimes it's a disturbance of the blood flow. Some other times it's just disturbance of the neuronal transmission. That is transmission of impulses in the nerves. You know, our brain is like an engine room with lots of cables or wires, which are nerves coming out of it and blood vessels going in and out of it. So for the headache, there is discomfort. And like I said, the causes could be, one, anything that will leads to a disruption or an interruption of either the blood flow or the neuronal transmission. Now, certain things can predispose someone to this headache. So, stress. The reason why we tell people to avoid stress any way you can. So, stressful situations do predispose people to headache. And this, in all shapes or forms. Then medical conditions that could lead to headache. Muscle spasms, physiologic changes, especially in women, menarche, which is the start of the reproductive life in the early teens, menopause, which is the end of the reproductive life in the early 50s or late 40s, trauma, if somebody has any form of injury to the head or neck region, that could also cause headache. Some medications, believe it or not, we use medications to treat headache, but some medications could also give headache. Any medication that increases the blood flow, where there is a surge of blood flow, could give headache. Some people are on some blood pressure medications that we commonly ask them if they have headache. Apart from all this, as well, visual problems. If you have an eye condition and you do not wear the appropriate glasses, or you have anything that is irritating your eyes, because the brain and the eye are very close together. So any disturbance of the eye or increased eye pressure, like somebody who has glaucoma, if it's not diagnosed, some people, believe it or not, have lived all their life with headache, and been taking all sorts of medications only to find out they have glaucoma. Dental problems. So you have a toothache. The teeth is very close to the brain. So that could also lead to headache. Ear problems, notoriously in little kids. In children, their ear is so close to the brain that any infection there could give them discomfort in the head. Unfortunately, these kids will not be able to tell you they have headache. All they'll do is to cry, cry, and cry. So please, if you have a little kid that is crying, any child below 2 years, please look into their ears. It could be that they are having an ear infection. So, in a nutshell, what causes headache? Physiologically, stressful conditions. Anything that puts you under stress, whether it is thinking about the financial situation in your home, whether it is thinking about your work, whether it's thinking about anything whatsoever, or not having enough sleep, taking too much of caffeine. We can go on and on and on. Anything that puts you under stress could increase the risk of you having a headache. Then any infective condition in the eye, in the ear, in the nose, even sinusitis. In the developed world here, influenza, you have flu, that will give you a headache. So anything that affects any of the organ systems near the head could give headache. Any inflammatory condition will give headache. And then some people have congenital, that is a disease condition they have from birth, which could also result in headache. Things like hydrocephalus or other problems with the spinal cord, this can also cause headache.
All right, doctor. I know when you were discussing, I was thinking about the condition of Nigeria right now. I think the economic crisis alone, God willing, we are believing God that one day things will change. Now, please, doctor, can you tell us what are the types? You mentioned it in passing, concerning talked about the headache, the head, the region of the neck. What are the types of headache?
Okay, thank you. So, notoriously, headache, like I said, there are so many ways we classify it. So we say primary headache, secondary headache. Primary headache means there's a discomfort in the head or neck on its own, ab initio, not as a result of any other disease condition. And we have secondary headache, another disease condition leading to discomfort. Then medically, we classify them different ways. We have several types of headaches. We have the one called migraine, which is a very common one people know. We have cluster headache. We have tension headache. And we have other minor types of headache. So, migraine, let me go with that one. Migrainous headache is a type of headache. It occurs in episodes. So, migrainous headache is something that affects a significant proportion of people, especially in the developed world. It's more in the female population, and this headache comes in episodes. So, somebody comes and describes headache that comes, they have persistent headache, and this headache will be there for, say, 3 days consecutively, and it goes away. Then next month, it comes back again. So in classifying this, we look at what we call headache days. And normally in a month, we say you need to have more than 15 headache days. Okay? There are many ways we look at this, but migrainous headache it's a headache that comes in episodes. It's pretty frequent, And people who notice it sometimes would describe what we call an aura. Aura is something that happens before the event. So some people will have sensitivity to light. You know the way we have cameras and everywhere here. If somebody has migraine, these lights are enough to precipitate migraine. So we say they are photosensitive. So some people may be some type of sounds that could precipitate this headache. And in terms of this migrainous headache, some part of the treatment is we tell them to avoid whatever that precipitates it. So you see some people, we tell them to wear dark shades to prevent bright light, don't look at bright light, and so on. Then there's another headache called cluster headache. This is also another type of headache. One of the main ways we know this headache is that this headache most times occurs on one side of the face. It affects the eye most times. There could be conjunctival ejection, so that is the redness on some eye, tearing of one eye. We call that cluster headache. Then we have another headache which we call tension headache. My dear Reverend, that could be the one we're having back home now, because when you are under so much stress, you have this tension headache. So it looks like the whole head is exploding. You know, it wants to fall off your neck. So that's tension headache. And then other types of headache. There's headache due to eye condition, like I said, dental condition, ear condition. So these are the main types of headache that we encounter, and each of them we treat a little differently in terms of the treatment that we offer. So maybe when we get to treatment, I'll talk about it.
All right, Doctor, you talked about the women having, it's more popular in among women. So you talked about the migraine headache, and that sometimes, I don't know, will you say that it's related to their monthly period or something like that? But let us not go into that right now. What I want us to know, is there any other medical condition that resemble headache that we can, think that people think that maybe we don't know, but may be related to headache or that condition like that?
Yes, there are so many of them. Like I mentioned, number one, some people are having headache for months, years, and it's all headache, and they take paracetamol, which we call back home, or Tylenol, which we know it here as the US. They take ibuprofen, all forms of non-steroidal anti-inflammatory medication. They borrow medication from their friend. Please, can you give me something? And the friend says, oh, this works for my headache. Can you give me, let me try. So hypertension could just present as headache because there is increased flow in the blood vessels in the brain. So that could be the only symptom for somebody who has hypertension. So that's one thing. Depression. So sometimes people have depression because of not having interest in doing anything and their perception of life. They just feel everything is awful. The world is coming to an end. They just have headache. So that's another thing that could present as headache. The other ones, as I mentioned, eye condition, glaucoma, ear condition, otitis media, that is inflammation of the inner ear. That could present as headache. Dental problem, somebody has tooth decay, or wisdom tooth that is impacted. That's a very common one that happens amongst middle-aged population. Then other major conditions in the brain. For example, there's something we call subarachnoid hemorrhage. It's a bleeding in the brain. This is where people say, I have the headache of my life, the worst headache of my life. Please, if somebody ever tells you I have the worst headache of my life, tell the person to call a doctor or go straight to the hospital. Sometimes what happens is people suddenly develop a headache from nowhere, and it moves from 0 to 10 in terms of intensity. That means something sudden has happened. If there's also aneurysm, which is an abnormal dilatation of any blood vessel in the brain, because the brain is an enclosed area that has no space for expansion. So if there's any buildup of pressure, the first reaction is that there'll be headache. So any bleed in the brain, or any abnormal dilatation in the blood vessel, or any increase in the brain size for any reason, it could be, for example, back home, meningitis, especially in little kids or older adults. Anything that causes inflammation or taking space inside the cranial cavity, which is the brain area, will lead to headache. So any infective condition could lead to headache. Cancers. So people could have all forms of tumors in the brain. Our brain has lots of soft tissue, from the cerebral hemisphere to the thalamus, to the medulla oblongata, to the cerebellum, all areas of the brain. Any of this area could develop a growth, and this could present as headache. So in terms of things that will look like headache, we start with the common thing like the high blood pressure, other common things like infections, dental problems, ear problems, eye conditions. All these things can lead to headache and depression. Okay,
thank you, doctor. I love that. I also want to advise, if you have anybody complain of headache, severe headache, as he said, this is the worst headache of my life, please rush down to emergency. Very, very important, but because that may be either something that is happening, either bleeding in the brain, or we call it, is it hemorrhage, right?
Yes.
So please, whenever you hear somebody say, this headache, holding his or her head, crying that it's the headache, I've never experienced it before, something very, very bad is about to happen. Please let the person rush down to the hospital. And again, doctor, please, is there any treatment option available for headache?
Yes, definitely. There are several forms of treatment. Like I said, first thing is when you come, we take the history. Doctor will ask you questions like, when did this headache start? What were you doing when it starts? When you bend down, does it get worse? When you lie down, does it get better? Oftentimes, people come to the hospital and you ask them all sorts of questions and they feel, oh no, this doctor is so nosy. Why is he asking me all these things? I just want a pill for my head. No, it doesn't work that way, because the headache you're talking about could be because of a problem in your liver, kidney. It could be somewhere else. Like I told you, it could be secondary headache. Something is happening somewhere and your brain is just reacting. So that's why we want to know the nature, the character, the duration. When did this headache start? Is there anything that makes the headache better or anything that makes it worse? So this will help us know. And the duration of the headache. Does it come and go? Any effect in your eyes and so on. So that helps us know exactly this is what is causing it. Then we do some tests. We do some investigations to also look for these secondary causes to make sure they are not the reason. Oftentimes when this headache is persistent, we go about doing some imaging of the brain, like a CT scan, when we can't figure out anything from our blood test and the other things. Some people may have just heart condition, like palpitation, the heart beating so fast. That is enough to even give them the headache. So when we do these tests, we're able to know what is causing this headache. And then knowing what is causing the headache, that now informs our decision in terms of the area to focus in terms of treatment. Then in terms of treatment, like every treatment in medicine, we have non-pharmacologic and pharmacologic treatment. Non-pharmacologic could be as simple as somebody takes 10 cups of coffee a day. That could give you headache. So you start with that and say, reduce the amount of coffee you're taking. Somebody is drinking alcohol so much or somebody is smoking so much. So non-pharmacologic treatment, lifestyle management. Then pharmacologic treatment. So pharmacologic treatment goes this way. The commonest one is just the Tylenol, as we know it in the US here. Back home, we call it paracetamol. So usually the adult dose is 1 gram twice a day. If it's Tylenol extra, as we know it here in the US, 2 or 3 times a day. Normally, if you have a liver problem, we stay at less than 2 grams per day. And if it's the other Tylenol that is 325 milligrams, we just do 2 pills 2 or 3 times a day. So that's the first line treatment. Then other forms of treatment we do. Some people, we give them non-steroidal anti-inflammatory medications. That's where your common ibuprofen or Motrin comes, or your diclofenac. This is one thing we use. Please, this non-steroidal anti-inflammatory medication, if you're taking them, take them after food. Do not take them on an empty stomach, because it could give you upset in your stomach. It increases the acid secretion in the stomach. So that's for the second line treatment. The other thing we do is a group of medications we call the triptans. People who have migraine know this medication very well. Sumatriptan is the commonest one that we use. These medications, they affect some transmitters in the brain to modulate function to treat the headache. So apart from this, then there are other medications that we use. Some of these medications are medications they give people who have depression. So sometimes people get confused. They come to the hospital, we give them a medication for headache, and they go and speak to a family member. The family member says, oh, this is for cuckoo people, don't take it. So things like gabapentin, Cymbalta, amitriptyline, these are medications we use for mood and depression, we also use them to treat headache. So in a nutshell, these are the several medications we use for headache. And when headache is very recalcitrant, or we find a tumor or anything that needs surgery, we do that.
All right, thank you so much, Doctor. This has been so informative. And viewers, you have had it all. And I believe that if you are having some of these symptoms, please go to see your doctor and regularly go for checkup, so that we can discover some of these illness, because there are a lot of, as he just said, a lot of things can cause headache to somebody. Thank you, doctor, once again, and we hope to see you again next week. And viewers, thank you so much. We want to see you again as you join us in this PM Pulpit. Bye-bye for now.
Hey, I welcome you to the Pew and the Pulpit, coming to you live from the Anglican Church of the Holy Spirit, Bronx, New York. The address is 3840 Seaton Avenue, off 233rd Street, when going towards the highway. And the address is, the zip code is 10466. 10466. Our email address is Anglican Church of the Holy Spirit @yahoo.com. Email us at Anglican Church of the Holy Spirit @yahoo.com. The phone to reach the church by phone, 929-944-3424. 929-944-3424. Come, we worship every Sunday at 11 a.m. It's just a 2-hour service. We are a live and happening church here in the Bronx, New York City, and in the center of New York City. And we are a welcoming congregation. We worship in English. All is welcomed, but we do not believe in gay marriage. So don't come expecting to be wedded in our church, because it's not part of our tradition. We are part of CONAM. CONAM is Church of Nigeria Mission in North America. So we're a full-fledged Church of Nigeria Mission here in America. Come and be blessed. Thank you.